I am talking about caring communication with your baby. The science and soul of the first 12 months. They were already listening when they were in the uterus. Hearing is the first sense babies acquire and the last tone to go when we die. There is a moment somewhere between the first cry and the first smile when a parent realizes something extraordinary. Their baby understands far more than they can say. Long before words arrive, a conversation is already taking place. It is written in heartbeats, eye contact, touch, tone of voice, and the warmth of a held gaze. This is not sentiment. This is science. And understanding it may be one of the most important things a parent, grandparent, or caregiver ever does. Why the first 12 months are irreplaceable. The human brain grows faster in the first year of life than at any other time, producing nearly 1 million new neural connections every single second. What shapes these connections is not just nutrition or sleep, it is communication. Every coo, every response to a cry, every sung lullaby is, biologically speaking, brain architecture in action. Neuroscientists call this serve and return interaction. When a baby makes a sound, a gesture, or an expression and a caregiver responds, it triggers a cascade of neural wiring that forms the foundation for language, emotional regulation, trust, and even future learning ability. Deprive a baby of this interaction, and the consequences are measurable, lasting, and heartbreaking. Provide it generously, and you give your child a gift no school, no app, and no technology can fully replicate. Month by month, what your baby needs to hear and feel. 0 to 2 months. The voice is the world. At birth, your baby already recognizes your voice. They heard it in the womb. Speak softly, often, and warmly. It does not matter what you say. Narrate a nappy change. Describe the ceiling fan. Sing an old song you have remember. What matters is the prosody, the musicality of your voice. Slow, high-pitched, melodic speech, what researchers call motherese or infant-directed speech, is not baby talk. It is neurologically optimized communication. What to do? Make eye contact during feeds. Smile when they look at you. Mirror their expressions back to them. These are not trivial gestures. They are the first lessons in empathy. 2 to 4 months, the beginning of conversation. Within roughly 6 to 8 weeks, something extraordinary happens. The social smile. Your baby isn't merely reacting to the wind. They are responding to you. They begin to initiate dialogue. When you smile back, you affirm the most fundamental truth they will ever learn. I matter. My signals are understood. The world responds to me. What to do? Talk to your baby as if they understand every word. Because in terms of emotional tone, they do. Pause after speaking. Give them time to reply with sounds or movement. You are teaching them turn-taking, the cornerstone of all human conversation. 4 to 6 months, sound becomes intentional. Your baby is now experimenting with vocalizations, squeals, raspberries, vowel sounds. They are not random. They are attempts to communicate. Respond to each one. Repeat the sound back. Add a word to it. Oh, are you telling me something? This responsive interaction is directly linked to larger vocabularies at age 2 and better emotional resilience throughout childhood. What to do? Read aloud, not for understanding and for rhythm, tone, and the ritual of closeness. Point to pictures. Name colors. Describe faces. Your baby's brain is cataloging every syllable. 6 to 9 months, the world gets interesting. Babies at this age start to understand that objects still exist even when they are out of sight, a concept known as object permanence. They babble with consonants like ba-ba-ba and ma-ma-ma, and they watch your face intently when something surprises them, a behavior called social referencing. They are essentially asking you, is this safe? Is this good? Your expression provides their answer. What to do? Constantly describe your surroundings. That's a dog. The dog says woof. He's big and brown. Use actual words, not just sounds. Sing songs with actions. Itsy bitsy spider, row your boat, because rhythm, movement, and meaning linking together help build language. 9-12 months, proto-language arrives. Now your baby points. This is a breakthrough. Pointing is not just a motor skill. It is the first act of shared attention, the ability to direct another person's mind towards something in the world. It is the precursor to language itself. They may also say their first recognizable word, often mama, dada, or the name of a beloved object or pet. They understand no. They wave goodbye. They clap when you clap. They are, in every meaningful sense, communicating. What to do? Follow their pointing, look where they look, name what they show you. Never dismiss an attempt to communicate as meaningless. Respond every time.